Good morning, good afternoon, and good evening to all of you. My name is Shardul Agrawala. I'm the head of the Environment and Economy Integration Division in the OECD Environment Directorate, and I'll be your moderator for today's Green Talk for the launch of our new report on mortality risk valuation and policy assessment, a global meta-analysis of Value of Statistical Life studies. Each day, policymakers are confronted with decisions about which policies to implement, from low emission zones and seatbelt laws to workplace safety provisions. Cost-benefit analyses help policymakers get a clear picture of the positive and negative economic implications of prospective policies, programs, and projects. Unsurprisingly, they're also the bread and butter of environmental policy making. For instance, how would we value the lives saved from air quality improvements associated with decreased car use? And this is an area where the OECD has done extensive work going back a few decades now. To set policies at their proper level, policymakers must balance economic costs, such as the higher costs of consumer products or higher administrative burdens for regulators, against potential economic benefits. And health improvements are a key part of those benefits, but oftentimes it is quite a challenge to quantify in economic terms all the associated health improvements related to specific policies. This is where the value of statistical life comes into play. The concept represents the amount an average individual is willing to pay to reduce their risk of premature death. It is an increasingly common part of cost-benefit analyses because it can provide clear values on the economic benefits of policies that seek to reduce mortality risk, such as air quality improvements, traffic safety, and public health initiatives. Our work on estimating the value of statistical life extends over a decade. In 2012, we published a landmark report which at that time represented the largest meta-analysis of its kind of value of statistical life studies. And since then, it has become a reference for governments and cost-benefit practitioners. Understandably, a lot has changed since 2012. Alongside new methodological developments, the number of value of statistical lives in the literature has nearly doubled just in the last decade, making an update both timely and necessary. It is against this background that we launch today our new report, which again includes the largest meta-analysis of value of statistical lives ever compiled. Alongside these updated estimates, the report also provides valuable guidance to policymakers on how to leverage the findings in practice. So coming to today's webinar, to kick off today's session, we'll explore the report's key findings via a presentation by my colleague Olof Bistrom, who's a senior economist in the OECD Environment Directorate, Henrik Lindhem, who's a partner at Menon Economics, and Ståle Navrud, who's a professor at the School of Economics and Business within the Norwegian University of Life Sciences. Following this presentation, we will hear reactions from two distinguished discussants. Lisa Robinson, who's a deputy director at the Center for Health Decision Science, a core faculty at the Center for Climate, Health, and the Global Environment, and a senior research scientist at the Harvard T.H. Chan School of Public Health, and Pushpam Kumar, who's a senior economic advisor at the United Nations Environment Programme. After these interventions from our discussants, we will open the floor to questions. And for those of you who are joining online, you can send your questions at any time during this event using the Q&A function in Zoom, and we'll try to address as many of them as possible within the time available. So please allow me to now pass the floor to Olof, Henrik, and Ståle to present the report's key findings.
Thank you very much, Shardul, for that introduction on this important topic. I will start with providing a brief overview of the background to our study, and then Henrik and Ståle will then share the main results of the work that we've done. But before going into that deeper look into our work, I also wanted to share maybe a couple of more words on how do you place a value on mortality risk. risk. This is a concept that Shardul already defined here briefly in this introductory remark, but it's really important that we understand how this value works, because it's fundamental to the study that we've done. So since environmental policies often have an impact on mortality and the risk of premature death, it is also important to understand how can we place a value on that. And there are two main methods that I wanted to share with you on that today. So the first is based on surveys, where individuals are asked about their willingness to pay for a small change in the risk of a particular event. It could be a fatality, a fatal disease. It could be improved, the willingness to pay for, say, improved air quality, with the idea of having the probability of death, if you will, being reduced. So that is what we call a stated preference study. There are also those that are based on actual observed behavior that you can see in the market. And one example of that, for example, would be if a person buys a bicycle helmet in exchange for a reduced risk of a fatality in case you would have an accident on your bicycle. So that's direct evidence of a willingness to pay to reduce mortality risk. So what these two approaches show is that we can derive empirically the evidence for people's willingness to pay for a small change in with a small payment for a small change in mortality risk. However, in order for this to be practical for policy evaluation, we often aggregate these values up to a probability of 1. And then that is when we talk about the value of statistical life, or the value of a prevented fatality. This is the key focus of this report. But I also want to note that there are a couple of other concepts that are important to keep in mind here. One is called the value of statistical life year, also known as VSLY, or the quality adjusted life year, which is also known as QALYs, or the disability adjusted life years, known as DALYs. So I just wanted to make a footnote that those are also concepts that exist. So Shardul mentioned the previous work that we've done on this. We published a study indeed in some 13 years ago in 2012, which included stated preferences, one of the approaches I just mentioned, and included data for meta-analytic data covering up to the beginning of 2009. It included about 405 VSL estimates. So the newer report that we have offers several improvements. It includes nearly all academic and gray literature that has been published in English over the last 50 plus years. And it is based on about 4,000 VSL estimates from 49 countries. It includes both stated preferences and revealed preferences approaches that are included together in the estimates that we present today. It is based also on a more systematic, replicable, and meta-analytical method and it uses more updated and state-of-the-art statistical methods for arriving at the results. So let's take a look then where these studies come from. The geographical distribution that you see here on this slide shows where these studies were done, both for stated preference studies on your left and revealed preference studies on your right. And even though the majority of these studies have been performed in Europe and in North America over the past 50 years, what you see on these maps too is that increasingly we're also seeing studies that are being conducted all over other parts of the world, such as Latin America, Africa, Australia, Asia. So the values that we're now presenting today has a broader coverage than what we showed in our previous work. So with that brief introduction, let me turn over to Henrik Lindgren, who's going to show us more details about the study that we have. So over to you, Henrik.
Thank you very much, Olof. You can go to the next slide, please. So this slide shows the three main steps of the study. So to the left, we collected data beginning from the last study that ended in the end of 2008. using a systematic review procedure that is more common nowadays, to compile a large data set. And from those studies that we collected, we extracted primary VSL estimates that were reported in the studies. And in addition to those primary VSL estimates, we coded variables that could help explain the variation in the VSL estimates. So the methods used, the types of risks, country, the year of the study, etc. So when we did that first, we had a good basis for doing a statistical analysis of this data, using regressions and multi-level meta-analysis techniques, combined with value transfer principles and methods, because we cannot just use the raw or the means coming out of that analysis. We need to adjust them to fit to the policy context that they will be used. So in the last step, we derived recommendations based on the analysis, base estimates for different country groups. And then we also investigated how to adjust these estimates by income differences between countries and when income increases over time, and other factors that I will come back to. Please, next slide. This shows a description of the types of risks that the studies have investigated. So to the left, you have the stated preference, the survey-based estimates, typically related to health, many to transportation. There are increasingly studies looking at natural disasters, climate, virus, etc. And for the revealed preference estimates, a majority of those are typically related to hedonic wage, so wage risk studies, so they are job related. But there are also other types of risks investigated in that literature, for example, people buying safety products, etc., to reduce various risks. And in terms of the health endpoints, the most commonly assessed sources of risks are cancers, different types of cancers, and respiratory and cardiovascular diseases, often related to environmental pollution. I should also say that we decided to use the 2009, the most recent data, for the basis for the recommendations and the analysis that we'll go through today. Next slide, please. Yeah, so we adjusted the estimates that came out of the studies by consumer price index from the national data up until 2022, and then we converted to US dollars using power purchase parity. And we did not do any adjustments of these VSL estimates due to income growth in the period that we are looking at. That is a step that is done later in the process, in the benefit transfer process. We also removed what we call here extreme outliers. This is a statistical definition of very unlikely high or low VSL estimates, so they are screened out. And then, as I mentioned, we go through the data and extract and code variables that are relevant both for understanding the variation in the distribution of these VSL estimates and that are relevant for adjustments for policy contexts. Thank you. Next slide, please. So over to the key findings. I should say first that we use a meta-analysis technique, a statistical technique that tries to uncover the underlying distribution of the VSL estimates. So this is a technique that takes into account that there are stated preference and real preference and different methods to derive the estimates. There's a large heterogeneity in the data. So there are several levels that tries to account for this. And also an important point I should mention is that we use the standard errors reported in the studies or as estimated by us to take account of the uncertainty of the underlying VSL estimates from the primary valuation studies. So these are estimated mean VSL values that come out of this meta-analysis. So we did this analysis for different groupings of countries. So when you see at the top, all countries, it's basically the whole data set, the global data from all studies that we have in our database. And from that, we can see a mean estimate of $5.5 million in 2022 terms. And the bar is the 95% confidence interval. And then we did the same analysis, limiting the data to these groupings, as you can see below: OECD, European Union, United States, and the high-income countries as defined by the World Bank. And the low and the middle-income countries have been grouped together because of the rather more limited data that we have available from those countries. And as you can see, the mean for OECD is 7.1, 7.6 for the European Union, 7.2 for the United States, and then you have 7.1 and 0.9. We call these estimates preliminary and weighted because they are the raw estimated means coming out of the meta-analysis. So we wouldn't recommend that these estimates are taken and used directly in cost-benefit analysis. For instance, for the global VSL for all countries, 5.5 million is an overestimation because we have overrepresentation of high-income countries among the studies that have estimated VSL. So then the next step, we will do adjustments based on income differences. Next slide, please. And then we also carried out meta-regression analysis where we include these coded variables that I mentioned. And on this slide, there are two things to note. First of all, there is not a notable difference between the revealed and stated preference methods per se. This is a big discussion in the literature that, for example, stated preference give higher values than revealed preference because they are hypothetical by nature. They're based on surveys. But we actually find that this is not the case here. We find more variation within the revealed and stated preference methods respectively. So consumer market studies give lower estimates. Hedonic wage studies are higher, and we find these stated preference methods, continued valuation and choice experiments are placed in the middle. So this is an interesting finding for research and also showing the robustness of our results. I should also mention that we have estimated the income elasticity of ESL. This is an important parameter to use when we transfer values between countries with different income levels. And also over time, when we can assume that countries will have income growth over time, and we are often analyzing policies that have impacts into the future. So we need to take that into account. So we also did other analysis of factors that can influence VSL, and I will hand over to Ståle for the implications of these results. Thank you.
Yes, thank you, Henrik and Olof. One question that comes up is what can explain the variation in Value of Statistical Life? So we did a survey and an analysis of the different factors that could influence it. And one thing that comes up is whether it's the same VSL depending on whether there are children or adults. And there are some evidence that reducing the risk for children dying prematurely is valued higher than reducing the risk for adults, that is above 18. But there is limited evidence on this. And even though some studies then find a factor of 0.5 to 2 higher for children, there is so much uncertainty around this, so we don't recommend any adjustment for this. But there are some countries that do use sensitivity analysis for measures that particularly affect the risk of dying prematurely for children and value that at a higher rate. For age, mostly it's an inverted U shape. That means that people value reduction in risk and have a higher value statistical life that increase with age up to a certain point, and then it declines again. But this is hard to operationalize when we talk about value statistical life. Cancers, yes, regressions suggest that there is kind of double value for value of statistical life when this is caused by cancer. However, these cancers are very heterogeneous and it's very hard to generalize it. And you could also say that if there are fatal cancers and there is a morbidity period before you die from cancer, these morbidity impacts should be valued separately. So we don't suggest any correction factor for cancer either. Then there is, when it comes to the different causes, or the other causes, there is some limited evidence for deviation from this base value statistical life for, whether this is due to pandemics or other causes. But again, the evidence base is too weak to have some general recommendations in this regards. So except for the GDP per capita, we do not suggest other factors for adjusting this base value statistical life. Next, please. So Henrik then described this unweighted value. So that's the kind of raw data that comes out of the meta-analysis. And as he also explained, this depends, of course, on the number of studies that have been conducted within these different country groups that we have designed. So what we've done here is to weight the result by the population and the GDP per capita in each of the countries within the country group. So these are the suggested base values. As you can see here, it's 2.7 million US dollars for the global average, 7.1 for the OECD, 8.4 for the EU 27, and for the US it's 8.5 and 7.9 for the high-income countries. This is the World Bank definitions of high-income countries, above 14,000 US dollars as a GDP per capita. No, gross national income per capita, actually, is the definition used. And then for the low and middle income countries, it's 1.1 million. So this shows that there is a range here depending on what country group you're in. This is based on willingness to pay, and which is also is again dependent on the ability to pay, which is rooted in the income and the GDP per capita. And the median is a bit lower. This median is not the kind of standard median. It's the median is based on a population weighting where you have median GNI per median GDP per capita divided by the average GDP per capita. So which varies a bit from 88% in the EU down to 80% in the US. Next, please. So how do we use these numbers in practice? So what we'll try to do here is to come up with a kind of simple and reliable and transparent way of using the results from this meta-analysis to come up with base value statistical life for different countries. And this is especially useful, I think, for countries that don't have any particular stated preference study or real preference study conducted specifically in that country and don't have any guidance on value statistical life. So it's kind of a simple adjustment. What we do here, if you want to calculate the base VSL in country J, is to take the base value statistical life in the country group that the country belongs to, and then multiply by GDP per capita in the country divided by the GDP per capita in the country group. So, and this very simple equation then, of course, assumes an income elasticity of value of statistical life equal to 1, which is what we found in the meta-analysis, as Henrik pointed to in an earlier slide. Also, you could then adjust this over time. So, the value of statistical life being dependent on income, so adjust for real income growth, and also then use appropriate discount rates. You could also adjust the base VSL with age, risk types, cause, or other factors, but this is not what we recommend because the evidence is too weak in our mind to do this on a general basis. So yes, there will be different value of statistical life across countries because the GDP per capita is different in different countries. Next, please. So to sum up this, this is the most comprehensive review and meta-analysis of the global VSL literature to date, covering both real and stated preference studies. And we find robust base VSL estimates, which is designed to be used in policy assessment in individual countries, but also internationally. So for policies that affect, for example, a country group like the European Union. The data allows for testing the alternative assumptions that we have used, such as the type of valuation method and also income elasticity, which we found to vary, but it centers around 1. And as we showed, especially those countries which doesn't have any valuation studies before, or which is not in the data set, because there are some countries that haven't had any valuation studies on statistical life. But then you can use this very simple this unit benefit transfer equations that you saw, using GDP per capita and income elasticity of 1. So that's especially useful, I think, for countries that don't have a VSL unit value in their guidelines for cost-benefit analysis. Yes, thank you.
Thanks very much, Olaf, Henrik, and Ståle, for sharing these insights. Now I'm going to move over to our 2 discussants. First to Lisa Robinson from Harvard. Lisa, given your many years of experience advising government agencies and other organizations on applying the VSL research in their policymaking, what do you see as the key contributions of this particular report?
Thanks, Shardul. When I was preparing these talking points, I had to fight the temptation to just say incredibly important repeatedly. This is truly an amazing accomplishment, an unprecedented contribution to the field. Although not addressed in today's presentations, it's worth mentioning that your work on valuing non-fatal risks in the SWATI project is also an incredibly important contribution. I think someone put the link to that project in the chat for those of you who are interested. I'd like to share a few thoughts first about the contributions of this report, then about how it will improve analytic efficiency and quality, and finally about the challenges that remain. This effort far surpasses previous VSL reviews in terms of comprehensiveness, sophistication, and rigor, as well as the quality of the documentation. I encourage everyone to read the report carefully. It provides a well-informed introduction to the underlying concepts and current practices, as well as careful explanation of the systematic review and meta-analysis procedures. It resists the temptation to provide overly simplistic answers, instead exploring alternative model specifications and adjustments in detail, with clear and careful explanation of the approaches, findings, and implications. As a member of the advisory group, I had a chance to see up close how challenging it was to conduct this study. Congratulations and many, many thanks to those involved for the hard work and the careful thought they devoted to this work. The results will substantially improve our understanding of the damages associated with not acting to address the mortality risks and the extent to which policy options lead to benefits that exceed the cost. By improving the evidence base, the report supports more welfare-enhancing policy decisions. In terms of application, the study provides an important foundation for government and other organizations who want to update or develop default VSL recommendations. Default estimates are an important aid to ensuring the consistency and comparability of the resulting analyses. Such defaults also promote analytic efficiency by allowing analysts to spend time addressing other difficult issues rather than conducting yet another review of the VSL literature. Many groups have been working independently to review this literature and recommend defaults. My hope is that this report will instead encourage increased coordination and collaboration, allowing us to move beyond multiple syntheses of the existing research and into conducting more primary research. Many organizations may use the estimates included in the report off the shelf without adjustment, understanding the careful work that has gone into developing these estimates. As noted in the report, selecting the estimate that are most likely to represent the preferences of those affected by a policy is key. These may be for an individual country if sufficient estimates are available, or may be for a group of similar countries. However, as recognized by the authors, deciding what criteria to use to evaluate the quality and validity of VSL studies and their application to particular contexts requires substantial professional judgment. Reasonable people can and will disagree. Many will, instead of using the default estimates that are in the report, some may prefer to apply different criteria to select studies or a different approach to combine and transfer estimates. Regardless, this report provides a firm foundation for applying these approaches. While this report is a giant leap forward, as always, challenges remain. The report highlights significant research gaps and inconsistencies, which should be priorities for future work. Chief among these, in my view, is the need for more research in countries underrepresented in the database, particularly low and middle income countries, to better understand the preferences of their population. The report also highlights the need for more research on the effects of differences in population risk characteristics. Perhaps more importantly, however, we need to keep in mind what these estimates measure. They reflect the willingness of individuals to exchange their own income for a small change in their own risk of dying in a defined period. These values can then be compared to the cost of a policy to determine whether it will result in net benefits from the perspective of the affected population. Communicating this concept is challenging and goes well beyond what can be addressed by this type of report. We all need to work to ensure that everyone, the media, students, colleagues, the general public, understand that these estimates are not the value that the government or someone else is placing on saving their lives. The estimates represent the value each place on small changes in our own risk of dying. Given that these values are bounded by income, assessing the distribution of net benefits across those who are advantaged and disadvantaged is essential, as is providing additional weight to the benefits that accrue to those who are worse off. These types of communication issues mean that default VSL estimates are difficult to change, even when this sort of substantial new evidence emerges. Misinterpretation of the VSL concept continues to be a large and difficult problem that hopefully we can work together to resolve. Thank you very much.
Thanks very much, Lisa, for your thoughtful remarks. I mean, both highlighting what the specific contributions of this report are, but also the point you made that, instead of having more syntheses and meta-analysis, perhaps the priorities moving forward should be more towards primary research, but also how this meta-analysis could be useful both in terms of the default estimates it provides, but also the facility for decision makers should they have the need to have more tailored estimates, how to use this as a foundation. I think the final point you made about communication is absolutely central because the concept of VSL still continues to be often misperceived and misunderstood. And I think all of us as a community have a responsibility to fully communicate what the concept is and what it is not. So thanks a lot. I'm now delighted to invite our second discussant, Pushpam Kumar from UNEP. So Pushpam, few studies, I mean, as the presentation also showed, a few studies on the value of statistical life have been published in the Global South, even though the situation is improving now. How can this report help advance cost-benefit analyses in low and middle-income countries?
Thank you very much. First of all, my huge compliments to the authors and OECD for bringing out this very rich and wonderful report, which is not only great in terms of methodology and updating of the data from 2012, but it is very, very timely. Timely for applied benefit cost analysis. And this issue has been a perennial issue in applied welfare economics for last 70, 80 years. So this is really the central issues in evaluating a project, policy, or their impact. So my huge compliments. But this kind of a study is useful uh, to set an incentive design or compensation mechanism between the gainers and the losers. So that additional point can also be handled by this kind of report. From UNEP, I'm coming to your question, Shardul, in a minute, but from UNEP's point of view, where we are struggling with triple environmental or planetary crisis, climate change, in loss and damage, this kind of VSL study will really help. But also there is a nexus between biodiversity and human health, impacting their mortality and morbidity, as we have seen coming from Global Biodiversity Framework from Kunming-Montreal Protocol. This issue was also raised there. This report will be helpful there too. And finally, the pollution, including chemicals and waste, the hard trade-offs are always present. And this kind of report and the estimates will help to come out with a credible number which has less hedginess and less gray areas for the decision makers. So I think all the checklist this report nicely complies with. Then one or two questions about the methodology, which we must discuss, and I have read the report, which you have handled very well. The methodology, you have mentioned willingness to pay, human capital approach, or averted behavior, and so on and so forth. And you will see that averted behavior is less than human capital approach value, and that is less than the willingness to accept. For the decision makers, it would be helpful if the productivity-based approach is used, because that really eliminates the loose corners and gives you something which is real, happening. There is a clear-cut dose and response relationship, and that is where human capital approach can help us. That will also help us because when we talk about tracking down the sustainability progress, it is not GDP, but it is wealth, as Das Gupta review for HM Treasury in UK has strongly put forward. So human capital approach would really help us. But whatever methods we go for, there should be a clarity of purpose. What for we are going to use this number? Is this for compensation? Is this for compensating the damage to the workers who have been injured or who have lost their life? Or is this the cost benefit analysis? Once the purpose is clear, choice of methodology becomes easier. Now, coming back to the question, Shardul, you raised, there are really very few studies in developing countries. I mean, India may be few, but they are mostly in the context of workers, the compensation context, where hedonic wage models have been used basically. And then you will find the statistical value of life is X in Mumbai, Y in Delhi, and something else in Ahmedabad. So, but I don't find much studies, the place where I'm speaking from right now in sub-Saharan Africa. So, capacity development is something we have to, I mean, the ministers, they really want to do it, but they have capacity issues. And they really want to, I mean, they are convinced that statistical value of life is a very useful way to go forward. And the communication, which Lisa has also mentioned, sometimes people confuse this number with the value of life and start talking about how one Shardul is equal to 10 Pushpam Kumar. That should be dispelled properly. I mean, otherwise, there will be all kind of abuse and misuse of this kind of approach and studies. And people bring the issues of ethics and justice, fairness, all those kind of things. They can be really addressed very clearly if upfront we mention what this number is, what it does, and what it does not do. So I think if that communication is clear, I think this kind of studies will be really a landmark. It is a landmark, but in terms of application and usefulness, we can do much better if the communication is clearer. I will just stop here. Thank you. And my compliments once again to all of you.
Thanks very much, Pushpam, for those excellent comments. So just walking backwards from what you said, so you reinforced the point Lisa was making about communication and avoiding the risk of miscommunication. So clarity on what the concept is, what is it measuring, and what it is not measuring, and that's something we also at the OECD can emphasize as we publicize and do outreach on this report. But then coming to this issue of the question I had posed, that there are very few studies in the global south, and you mentioned that there are some studies related essentially to worker compensation in India and sub-Saharan Africa, hardly any studies at all, and I think this issue of capacity development is quite important because, I mean, the workaround is just using benefit transfer and techniques like that, and developing estimates for other countries with very different incomes. But I think the real issue is to build the capacity in the countries which have not done these studies, and so that you can actually deepen the research base of studies, and having a much more diverse set of countries and circumstances reflected in the primary research. So again, it's a very, very important point. I was quite taken by the link you made between these kinds of assessments and the triple planetary crisis. In fact, like UNEP is doing its global environmental outlook, looking at the triple planetary crisis, we at the OECD are also finalizing our next environmental outlook, which is looking at climate change, biodiversity loss, and pollution. And the impacts on health are quite prominent. But the points you're making resonate very well with us, and we will also be thinking in terms of how to connect these findings with the work that we are doing on the triple planetary crisis. So thank you both to both our discussants for those excellent remarks, setting the stage for the Q&A. Again, for those who are joining online, please do send us your questions using the Q&A function. But to kick things off, let me just ask the authors, Olaf, Henrik, and Sturle. I mean, we're talking about mortality risk, obviously, in this particular report. But can you say something about analogous approaches, or what could be done to get a better handle on morbidity risk? Olaf, you're on mute.
I might say a few words, maybe.
Please go ahead.
Both sources. Yeah. So we are actually doing a lot of, studies, and Lisa mentioned the SWORSHI studies that is done with the OECD, also to cover the morbidity, because there is a lot of morbidity. So for example, I mentioned cancer. Cancer is not all cancers are fatal, but there is a lot of morbidity costs. So we are doing studies within this SWOTCHE program and within several EU-funded projects. And in the US, there is also a lot of activity in doing new surveys. So in the SWOTCHE, it's multi-country surveys, which is very good. You do the exact same valuation study in many countries at the same time, identifying health endpoints, in this case from chemicals, but many of them can also be due to air pollution. So it's using the same type methods, but particularly the stated preference methods of both discrete choice experiments and contingent valuation to derive people's willingness to pay to avoid an episode of well-described and descriptions of these different illness episodes. So it's very much the same type methodology as we use for Value of Statistical Life. What becomes even more similar is when you have chronic illnesses, where there is a risk of attracting it, and then you value the symptoms and the willingness to pay to avoid them if you get it. So then you get value statistical cases, for example, non-fatal cancer, that will improve even more the economic assessment of health impacts from different environmental stressors, which will be very important in terms of coming up with a more comprehensive valuation of the health impacts in cost-benefit analysis of measures, for example, to restrict chemicals.
Thanks very much, Ståle. And I'm going to move to the next question because questions are piling up here. But it's a very good question which came online is, that we made the point in the presentation that a lot has changed since 2012. There are a lot more studies. We're looking at both stated and revealed preferences, and there are a lot more countries these studies have been conducted in. But the underlying question that is being posed is, how much this greater sophistication and improved data sets, how much have they changed the conclusions and the results since the 2012 study? So any of the authors? Henrik?
This is a very good and a bit complicated question. It's explained more carefully, of course, in the report, what the differences are between the old and the new study. The most important two innovations, I guess, is the complete inclusion of all methods, both the stated and the revealed preference, and we also include the consumer market studies that haven't really been included before. So that's sort of the one important change. The other one is that we use meta-analysis methods that are different. Now more sophisticated because we can take account of the differences in the levels of the data and also the uncertainty of the estimates. So we have done some comparison between the old and the new. It's a bit difficult to say in very few words what the implications are, but I think we can say that we are wiser now than we were then, and the estimates that have been presented here are at sort of state of the art, or moving the state of the art of this kind of work, while the old report was, for example, a bit more difficult to analyze data that we didn't have standard errors, etc. So we have made some improvements, but I haven't maybe not answered the questions clearly. I think that the results we have now are more comprehensive. We have a better coverage of the preferences of those that are affected, and then more detailed comparison. Maybe we can do in another forum where we can also go into the more technical details.
Okay.
Maybe if I can just add a couple of very, very brief promise, Shardul. But the fact that we have 6 regional groups that we look at, sort of country groups as we call them, I think is a major improvement compared to what we did before. And then also highlighting that the confidence bands that Henrik mentioned briefly, they really are an improvement compared to what we were before. And the fact that we can have now do some sensitivity analysis. So in the data that will be released shortly that we're going to have available from OECD on our website, in addition to the report, we'll also have the tools to allow you to do some sensitivity analysis. For example, look at the income elasticity, what happens if you have higher or lower, what happens if you look at just the stated preference studies versus just the revealed preference studies, and so on. So there are many, many more ways in which a user can use this as well. So I just wanted to highlight those things.
Thanks very much, Henrik and Olaf. I think we have to leave it here, and maybe we'll schedule you for another Green Talk to dive into direct comparisons between the 2 sets of studies. Let me pose a question now to Lisa. I mean, we have this new guidance, but countries are generally slow to change their guidance on how to value mortality. So what advice would you offer policymakers that are considering an update of the VSL? And how can this current study help them in that process?
Thanks, Shardul. That's a difficult question. I think that every country needs to look very carefully at this data set, think about the context in which they're applying the estimates. Excuse me. Think about whether the screens that are used for quality and validity are the ones that should be used. I do think that the biggest problem that we've had in the US is this issue of people not understanding the concept. I can't tell you how many people I've talked to who have said, we do not want to change our agency's value, because if we do, there'll be lots of headlines about how the US EPA or the US Department of Health and Human Services is devaluing individuals' lives. And I think people start to feel like fighting that, spending all your time trying to explain the VSL concept instead of the thing that you're really trying to do, which is improve environmental quality or welfare more generally. There's a huge opportunity cost there. So I think that that's one of the reasons why I think this issue of better communicating what these values are is of foremost importance.
Thanks very much, Lisa. Pushpan, just building on your earlier remarks, I was just wanting to know a little bit more how UNEP, your agency in particular, might be using VSL estimates, or what role it could play. You mentioned the need to build capacity in many developing countries. Are there any initiatives at UNEP which are underway in that direction, and are there any opportunities to partner with you where some of this expertise, which is reflected in this report, for example, could be cross-fertilized?
Thanks, Abdul. So as you know, 3 months back, there was an intergovernmental panel on chemicals. So it is the third after IPCC or IPBES, there is a panel on chemicals. And the member states are very keen to see that what is the cost of inaction. And the cost of inaction is also in terms of loss to human life. And there is some study right now we have started that what is the cost of inaction globally, and with regional disaggregation. So Europe, North America, Asia Pacific Rim countries, Sub-Saharan Africa, and I think we are going to use this report in a big way. But one thing I can tell you that. At the political level, governments are very keen. If you see for the last 30 years, there has been a paradigm shift. In the beginning, I remember 20 years back, politicians would be a little reluctant to accept this kind of, a statistical value of life. Now there is a greater appetite for this kind of number. I mean, in 30 years back, if you say, a statistical value of life or anything related to value of life, forget about it. It will not fly, at least in the political lexicon. But now people are willing, they want to do it. So chemicals and plastic, I mean, plastic is not still very formal, but chemicals, yes, member states have given the green signal. In cost of inaction, I think that is where I think OECD and UNEP should join hands to bring good science on the ground. And you can see the upscaling of this kind of studies and going to the people where it matters the most in terms of allocating resources, pumping investment for pollution abatement activities and controlling chemicals. So I think I can see a clear, use of this study through the intergovernmental panel on chemicals and the secretariat, UNEP and UN, which we can do. So I think there is a good potential there, Shardul.
Thanks very much, Pushpam. I think this linking it to the discussions around the cost of inaction and specifically in the chemicals and plastics context. I mean, on chemicals, as Lisa mentioned already, we have ongoing work over the last several years on looking at the evaluation of morbidity risks related with exposure to chemicals, and of course combined with the VSL work, we have a major program on chemicals within the Environment Directorate also. So there's a lot of expertise and work we can we would be happy to build upon. And likewise on plastics, we've been doing a lot of work on plastics, although not looking at the costs of inaction on plastic pollution. So excellent points, and look forward to following up with you later to see what opportunities there might be. There are more questions coming in on the report and the authors, and so there's one question which is noting the higher values of cancers. I mean, going back to the comments Ståle made earlier, noting that higher values of cancers are linked to cancer morbidity rather than mortality. Do the average values presented in the report include studies that have looked specifically at cancer or not? And how much difference does it make, including or excluding cancer studies, for the overall estimates? So, any of the authors?
Maybe I could start. The database includes studies that have cancers included as a source of mortality risk. It's sometimes a bit difficult to classify cancers in the different studies, so we have a dummy variable that shows whether or not a study has cancers as a source. So we have investigated the effect of cancers, but it's, as Ståle said, that it's significantly positive on the VSL estimate, but it's difficult to use or to classify, since we need probably to go more into detail in the studies of individual types of cancers. And this is a very heterogeneous data set across many countries, so it's difficult to get that kind of detail in this kind of analysis, but it's a good point. And it's also important to think about not double counting the morbidity costs of cancer with a VSL also related to cancer, and that's of course another topic also. When you count both the morbidity and the mortality costs, you need to try to delineate those two so you don't double count.
Thanks very much, Henrik. I think we'll have to leave it here because we are reaching the end of the webinar. So allow me to first thank the presenters of the report, Olof, Henrik, and Ståle, and our two excellent discussants, Lisa and Pushpam. It's really been a great session and a very informative session. I didn't mention that Henrik and Ståle were the co-authors of the 2012 meta-analysis. So all the new questions and research gaps we have identified, maybe we will invite them 10 years from now to do the next iteration of this work. Lisa has been very active in the advisory group of this work, but also in the SWACHE project looking at morbidity risks, and we hope to continue the collaboration. And Pushpam, great to connect with you and explore all these opportunities where we could link the work of the OECD and UNEP going forward in this very important area. So thank you to all the people in the audience for joining us today. To access our report on the value of statistical life and to learn more about the OECD work and cost-benefit analysis, please visit our dedicated webpage, and my colleagues have put the relevant links in the chat. And finally, please don't forget to join us for our next OECD Green Talk Live, which is entitled From Risk to Resilience, Integrating Water into Financial Stability Frameworks. And this Green Talk will take place on October 15th. And a link to register for that Green Talk is provided in the chat as well. So thank you all once again, and have a good rest of the day. Thank you.